Hello again and welcome to our channel. Today we'll be talking about the Glasgow Coma scale. But before we continue, I would like to ask you to subscribe to our channel and hit the notification so you don't miss any of our subsequent video uploads. The Glasgow Coma scale, or GCS for short, is a neurological tool that is used to assess a patient's level of consciousness. It is used particularly after a head injury or in patients who are critically ill. The GCS has three components, and they include the eye opening response, the best verbal response, and the best motor response. So let's begin with the eye opening response. The eye opening response measures a patient's ability to open their eyes either spontaneously or in response to a stimulus. The maximum score is 4, while the minimum score is 1. The score of 4 represents spontaneous eye opening. That is, the patient is able to open their eyes without any form of stimulus. The score of 3 is given when the patient opens their eyes to speech. In this case, the patient is able to open their eyes to sound. The score of 2 means that the patient opens eyes to pain. That is, the patient is only able to open their eyes when pain is inflicted. The score of 1 is given when there is no eye opening response at all. This mnemonic on the screen may be used to remember the eye opening response component of the GCS. The next component of the GCS is the best verbal response. This assesses the coherence and appropriateness of a patient's speech. It is scored from 1 to 5 as follows. The score of 5 means the patient is oriented in time, place, and person. This part of the GCS is tested by asking simple questions that test patient's orientation. Orientation in time can be tested by asking the patient questions such as, what is today's date? What day of the week is it? Or what season is it? Orientation in place is tested by asking the patient questions such as, where are we? What is the name of this place? Do you know where you are? Etc. Orientation in person is tested by asking questions such as, what is your name? Who are you? Do you know your name? If they get the questions correctly, then they are said to be oriented. Otherwise, they are disoriented. A patient must be oriented in time, place, and person to get the score of 5. The next is the score of 4, which means that the patient is confused. It may also be referred to as disoriented. This applies to a patient who is not oriented to at least one of the 3, that is time, place, and person. The patient can converse normally. However, some of the or all of the responses to the above questions about time, place, and person are incorrect. The score of 3 means inappropriate words, and in this case, the patient uses inappropriate or random words which do not make sense in the context of the question or conversation. The score of 2 means incomprehensible sounds. In this case, the patient makes sounds such as moans. However, they cannot form words. 1 means no response. That is, the patient is not able to make any sound. This mnemonic on the screen may be used to remember this aspect of the GCS. The next component of the GCS is the best motor response. This evaluates the patient's ability to follow commands and respond to physical prompts. It is scored as follows. The score of 6 is given when the patient obeys commands. This is as simple as it sounds. And the patient obeys reasonable commands given to them, such as raise your hand, stand up, and turn to the right side, etc. The score of 5 is given when the patient localizes pain. In this case, a noxious or painful stimulus is inflicted for at least 10 seconds, commonly by use of a supraorbital pressure, sternal rub, or nail bed pressure. In response to this stimulus, the patient moves their arms towards the stimulus. The score of 4 means flexion withdrawal. This means that in response to this painful stimulus, the arm flexes and moves rapidly away from the stimulus. The patient is not able to localize a painful stimulus. The score of 3 means abnormal flexion, which is also called decorticate posturing. In this case, the elbow flexes and the arm comes across the body with flexed wrist and clenched fist. In the lower limbs, there is internal rotation of the hips, extension at the knees, and plantar flexion. The score of 2 means abnormal extension, which is also called decerebrate posturing. In this case, the patient extends the elbow with adduction and internal rotation at the shoulder, as well as forearm pronation, flexed wrists, and clenched fists. In the lower limbs, there is knee extension and plantar flexion. Note that the major difference between decorticate posturing and decerebrate posturing is that in decorticate posturing, there is flexion at the elbow, while in decerebrate posturing, there is extension at the elbow. The score of 1 means that there is no response. This part of the GCS may be remembered with the mnemonic shown on the screen. So at the end of this assessment, the scores gotten from each of the components are added together to make up the total score. That is eye-opening response plus best verbal response plus best motor response. Remember to always document the individual components and not just the total score. For example, a GCS score of 9 may look like this: E2, V3, M4. As for the interpretation of the GCS in the context of a traumatic brain injury, it is classified as mild when the GCS is between 13 to 15. Moderate traumatic brain injury is when the GCS is between 9 to 12, while severe traumatic brain injury is when the GCS is 8 or below. Also note that a GCS of 8 or below is an indication for intubation in order to protect the airway. The limitations of the Glasgow Coma scale include: in patients with facial trauma or swelling, the eye-opening response may be affected, and this should be noted when documenting the findings. And in patients with intubation or tracheostomy, the best verbal response score is affected. This also should be noted as a T added to the verbal component. Example, V1T. The T indicates the tube. Paralysis may affect the assessment of the motor response, and also sedation as well as intoxication can affect the patient's scores.